morning. I'm Dr. Pramod Bhor, robotic joint replacement surgeon and director of orthopedics at Fortis Hospital, Vashi. Today we are going to speak about bone stress. So bone stress matlab kya? What is bone stress? So bone stress is an injury happening to the bone, I would say, because of repetitive similar amount of activity. So whenever a person is jogging, so हम लोग एक simple पकड़ के चलते हैं. Bone stress is happens when the bones are weak, plus there is the same activity again and again happening at the same point. Repeated hammering होता है उस जगह और उसके वजह से उस जगह पे थोड़ा stress fracture या bone stress आ जाता है. So this happens because of regular exercises or regular activity at workplace where people are using hammering instruments or they are using they have to run or jump in that work profile. Common is that we are seeing in the urban countries with the advent of what I would say when the people are becoming more and more aware of their health, that is why they start jogging, running. So common हम लोग देखेंगे अभी post 31st of December, whenever the new year starts, have a new year resolution that will become fit and they start jogging all of a sudden, and they start jogging and then they start having stress fractures around the shin of the tibia, shin of the bone, shin of the leg. So shin pains are the commonest symptom. Again, pain होता रहता है पेशेंट को, हम लोग भागते हैं, जॉगिंग करते रहते हैं, and whenever this happens we have to stop. ये लोगों को समझना जरूरी है कि हम अगर ये स्टॉप करें, कैल्शियम विटामिन उसको सपोर्ट करें, कैल्शियम विटामिन डी दें एंड allow the bone injury to heal, then it will recover faster. But that doesn't happen. The people start running, they keep on running, and that causes further stress gets converted into a bone fracture, stress fracture. So when the stress fracture is there, then it becomes very difficult to walk. So अगर सिर्फ bone stress है तो without a fracture, this the pain comes only when you are running or when you are jogging. But fracture होने के बाद then you have to be in bed. So that further decreases your action and your whatever you are trying to achieve by doing that exercise will go in reverse. So it is very important to understand whenever you are having any kind of symptoms, any kind of pain while doing any exercises which is or any exercises is aggravating your pain, you should stop that exercise, consult either your trainer or an orthopedic surgeon why this is happening, get it treated, and then go on and start back your exercises. It will not cause further complications like a fracture or anything. So it is very important for you to understand कि हमें any kind of exercise जब शुरू करें तो हम ये exercise क्यों शुरू कर रहे हैं वो ज़रूरी है. ये exercise long term तक कैसे चालू रखेंगे वो समझना ज़रूरी है. long term तक चालू रखने के लिए any kind of pain, कोई भी दर्द हो, हम उसे ट्रीट किए बिना आगे नहीं बढ़ना चाहिए. दिस इज द टेक होम मैसेज फॉर मी टू टेल यू. सेकेंडली ये ज़रूरी है कि एनी पेशेंट, एनी पर्सन अबव 50-55 शुड बी टेकिंग प्रॉपर कैल्शियम एंड विटामिन डी रिच डाइट्स बिफोर स्टार्टिंग विद एनी एक्सरसाइजेस, एंड दे शुड सी कि दे आर स्टार्टिंग एक्सरसाइजेस स्लोली एंड स्टेडली. So if you have a resolution and you cannot start running 2 kilometers per day, start with walking first. धीरे धीरे शुरू करके ऐड करिए. सबको मालूम होता है बट करते नहीं है, लगता है हमारी बॉडी झेल लेगी, बट नो, इट इज बेसिकली जैसे जैसे उम्र बढ़ती है वी हैव टू थिंक कि ओके वी आर नॉट दैट यंग नाउ वेयर वी कैन रियली गो अहेड टू दैट स्टेज इमीडिएटली. तो हमें स्लोली एंड स्टेडीली ही बढ़ना है. सो टेक होम मैसेज इज व्हेनेवर हैविंग पेन, wait, consult, and then go back to your regular exercises slowly. And secondly, have a calcium and vitamin D rich diet when taking exercise.